you say that, because that is my segue into this next spot. Yeah. So this, I know that I'm a bit animated about stuff, and I'm like, this is the greatest thing in the world, and stuff like that. But this is the most important chapter that we will be studying today and tomorrow in this entire book. The most important chapter.
If it's the most important chapter, why are there only 2 days on it? Because this is a very long chapter.
Because your teacher is an idiot. Mr. Ibarra actually said, you sure you want to give just 2 days to that? And we had so many other things to pack in. I was like, well, that's all we got. And he goes, really? Like, he told me exactly what you told me, Miss Petrie, and I made the final decision.
Watch your language, young man. You have really young people here watching, hearing your class.
But what did I said idiot? Yeah, anyway, okay. I'll watch my language. Sorry, Miss Torres. Anyway, sorry, Allison.
I'm just kidding with you.
No, I've got to set a good example for the young folk out there.
I don't like it.
You can just say, oh, I'm such a gobbledygoo.
Gobbledygoo.
Your teacher is a gobbledygoo. And anyway, Mr. Ibarra actually pointed this out to me. And then I was looking like, well, what could I cut and stuff like that? We have to stay on a certain schedule. But like, I should have cut things like the urinary system. Like, I mean, really. So you're right, Miss Petrie. But I will say this. Theoretically, we should have already covered a lot of this because the way I've designed the course and the way it's been taught. And you will
I agree. There was a lot of it that you set the foundation for it. So I get it. I get what Ms. Petrie and Mr. Ibarra are saying,
yeah,
but I also
they're right.
completely agree with what you're saying. We went over pretty much almost all of it.
Yeah. And here's my thing is, I agree, this is my time to tell you all, like, you're about to graduate. You know, I know Mr. Kandari said 3.5 months, but 3.5 months will go by like that. Remember, there's a couple of externships, maybe a clinic in there. It's going to go by, it's over. We are over 50% of the way through, and think back, the last 50% went pretty quick. It really did. And it's like what Miss Petrie's saying. She's like, I need to learn stuff now before I graduate. Because Miss Petrie knows something that some other people sometimes forget. She knows that in the massage room, nobody asks what your grade was in school. What happens is they start talking real anatomy to you. And you either know it or you don't. And clients figure it out really fast, who knows it and who doesn't. And so, yes, so this is your chance to pull together some stuff. This is your chance to start paying attention more. I actually recommend you kind of ramp up your attention to the class towards the end here, because this literally translates, your knowledge literally translates into dollars and cents. There are some massage therapists out there that make 20 bucks an hour, and there are some that make 100 bucks an hour. That's just a fact. And so that's 5 times the earning potential, because these people can kind of do their anatomy better, and they earn higher respect and they earn higher wages. Yes, Ms. Monreal.
So I've been meaning to ask you this, but then I always forget. So you charge $100 an hour. Do most clients tip you past 100?
They do. It's been a long time since I did a massage, I think like 6 months ago. To be very honest with you, I went to some.
I would say typically they do, though.
But they really do.
They know that this is your rate. It's kind of like when you go to a hairdresser, but you know that hairdressers, a lot of them are pricey. Like, that's just the price. It's the quality of whatever product they're using or whatever that's costing them money too. So it's kind of like the same thing, that you know what their price is, but you always tip on top of that.
Yep. Now, what I have noticed in massage, Ms. Monreal, is people don't tip like when they go out to eat. People tip on a percentage basis. On massage, they just typically give 20 bucks every time if they really like their massage. They'll give you 20 bucks on a cheap massage. They'll give you 20 bucks on an expensive massage. That's just a very typical thing per hour. But I started charging 100 bucks an hour a long time ago because I didn't want to have to worry about the tip. And this way, if somebody stiffed me, I didn't really care. I was like, it's 100 bucks an hour. But I found that, strangely enough, most people tipped. And people that are willing to pay more for massage tend to be more ready to tip, believe it or not, anyway. Because they can already afford 100 bucks an hour, you know?
Yeah.
So, but when I used to do my hockey player, we did 100 bucks an hour. This is a really interesting example. So $100 an hour, and we'd sometimes do like 4-hour massages, right? And so that was $400 he had to pay me, and he would often pay me $450, which if you think about it percentage-wise, it's not a great tip. It's about 12%. So I actually made better tips on smaller. By the way, I didn't care. He was amazing, and I walked out of the house with $450. Like it was like he didn't need to tip anything. I didn't think he was being cheap. I thought he was being generous. But my point is, the tips are not quite. They don't work out the way people are just like, oh. And for him, he's like, oh, here's an extra $50, which is pretty generous, and he just gave me $400. So yeah. But anyway, they tip. Yep. People almost always tip on massage. I would say. I feel like I've been stiffed in massage maybe a handful of times. Miss Petrie, how many times you've been stiffed? Almost never, right? Yeah.
And
Not very often.
Yeah.
Do you mean not tipped or like someone actually stiffed you?
Oh no,
like
not
you
tipped.
did?
Not tipped. I've been paid
okay.
every time. I've never not been paid ever in my
Okay.
life. My friend, who Miss Petrie knows, Mike Burns, who's a massage therapist too. And he said he had a little old lady come in one day, and she said that was a really good massage at the end. And she goes, I'm going to give you 2 quarters. And she did. And he thought it was the greatest thing ever. Like he thought it was just wonderful. He thought it was so sweet. And he said she actually put one down in his hand and then stuck the next one down in his hand. And she was like, thank you, young man. And he was like, oh my God, thank you so much. So stuff like that happens occasionally, but that's cute. You gotta laugh about stuff like that. Anyway, yeah, you get tipped. Miss Torres, yes.
Where I work, that happens a lot because there's the Goodyear, Dorado, there's like a lot of retirement, like the snowbirds. So there's a lot of older people, so sometimes they'll be like, oh my God, this and that, and they'll give you like $2. But like you say, it's like the cutest thing because they think they're giving you a lot of money.
I know they do. It's like your grandmother that you're 50 years old, she still sends you $5 in the little envelope, and I'm like, Grandma, I thank you. It's even cuter though. Like it's the best thing in the world. Yeah.
It is. Sometimes they even write stuff in the envelope like thank you. It was really nice. Like you are this, you are that, and then there's like $2, $3. Sometimes there's some quarters in there, and it's just like you say, it's just so. It's so cute because they think they're giving you a lot of money, and oh my God, it is cute.
By the way, thank you for sharing that. By the way, don't tell clients what you make per hour, because what I have found is that clients go, well, $25 an hour, like that's more than what I make, and they start to think like you're rich. They don't realize you don't get paid when you don't have a client. You're not working 9 hours a day, 8 hours a day. You can't. They don't factor all this stuff in. They don't recognize that sometimes you're not getting health care. And so they hear that number and they get really stuck on it. And then that tends to hurt your tips. So I don't talk to clients about what I make. And it's the one rude thing I've done. I'll have clients go, how much do you make an hour? And I go, how much do you make an hour? And they go, oh. And I'm like, yeah. Like, it's just not an appropriate question to ask somebody. Yes, Miss Monreal.
But, I mean, what do you mean, how much do you make an hour? What are they paying you an hour? Say what you're paying me, that's what I make an hour.
Well, those clients know what you make an hour. But like a lot of times you'll work at an establishment.
Okay.
And they're like, oh, you make $25 an hour. And they think that they put the tip on top of that. They're like, that's $45 an hour. Like, that's a good profession. I'm like, it is. It is, but you don't realize that we're having to compensate for a lot of other stuff, and that when you don't show up, I don't get paid anything and all that kind of stuff. They don't realize what happens during certain times and such. So I just find it's not helpful to your tips. What is helpful to your tips is to remind them you have kids, to remind them that you are a person, to remind them all these kind of things helps your tips. I used to always mention my twins. Every single massage. Mention my twins. Yeah. And I had people be like, here's $20 for one of your twins, and here's $20 for your other twin. Say that to me. So,
I guess I better start making up some children.
Yeah, you need, Miss Petrie, you need triplets.
I gotta keep them all.
Triplets.
I gotta keep them all straight too.
Triplets.
Miss Petrie, I gotta make sure I have all the right names down.
Yes.
Miss Petrie,
Yeah.
mention your birds. You're like, you don't even know how expensive are my birds.
I like that. Yes. I also we're getting way off subject too, but I also think it's very helpful to always have a boyfriend or a girlfriend or be married. Because clients end up kind of falling in love with their therapist, and it's just a lot easier if you can, you're always married, you always have a boyfriend, or you always have a girlfriend or something. Yeah.
Never
Yes.
be single.
Yes. Yep.
Never
You're never-
say that you were single.
Because then you
It
don't ever
was
have
just
to.
in their mind. A
Yep.
bunch of stuff just starts floating around in their head of, I'm gonna ask her out.
You're single.
I think we'd get along really well. That's
You're-
my therapist.
Yeah.
She already knows things about me.
And they think you get along really well because you're showing them your best self. They're paying you to be happy and happy to see them all the time. They don't realize part of that is your job. Yes. By the way, you're always in a relationship, and your relationship is always going well. It is that, and that's true for two reasons. One is for what Ms. Petrie's talking about, but two is do not bring your dirty laundry into a massage room. So if you had a fight with your boyfriend or girlfriend that day, that never gets discussed with clients. Your relationship is always going wonderfully. It's always going to be a long-term relationship. It's always going well. Always. Always. I don't care if you're lying through your teeth. I know I'm telling you to lie. I'm telling you to lie. No matter what. Hopefully it's true, but I don't care. Cool. All right. Any other questions that have nothing to do with chapter 21 that we're going to discuss today? No? Yes, Miss Hunter.
I don't know if it's my cell phone, but like your camera is really zoomed in.
It is. It is. It actually needs to come up a little bit too. But it is, yeah. But you don't like, you don't want to see me this close?
All right, I didn't know you were aware. My bad.
Do you want me back here?
Nope, you're fine.
No, I appreciate you letting me know. It is really zoomed in. I was sitting there being like, I don't even quite fit in the frame. Yeah.
Oh, okay, cool beans.
Cool beans. All right. Okay. So let's talk about any other questions, by the way, really. These are important things to know. Yeah. So I guess what I am entreating you all to do is to really engage as we go towards the finish line here. Any bit of information that you pick up now will be very, very important to your future as a massage therapist. You will actually enjoy your job more and you will make more. You will enjoy your job more and you will make more. And this chapter epitomizes that. This is kinesiology. This is where we review stuff we've already done and tie it all together. And it doesn't mean we're not going to learn more anatomy. We still have to do like lower legs and feet and forearms and hands. But this is where you tie together all the concepts that started 4 months ago when I told you muscles can only do one thing. We've gotten way past that. I'm hoping that you guys will actually see how far you've come too during this time. So let us start down that road. Please ask questions. Please be engaged. Please be willing to say the wrong thing so we can fix it now. Please, 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 please. All right. Kinesiology. By the way, in all of my other slideshows, I think you've noticed that I've underlined certain things. I've done that because I thought they were important, or I've done that because I thought they were kind of frivolous and I knew you were going to be tested on them. I just want to make your life easier. You will notice nothing underlined on this entire presentation because everything is important in this entire presentation. Yes, Ms. Torres.
Sorry to interrupt.
No, it's okay.
Tori said she's running late, so she should be.
Victoria is running late?
Yeah.
Okay.
So she just wanted me to tell you.
Okay, thank you. I appreciate it. Okay, so kinesiology. Kinesiology is a study of human motion. Ology, anything that ends in ology is a study of. And if you think about it, your clients are coming to you in general because they have a problem with motion. Now, the good news is most massage schools don't teach this at all. Which means for those of you that have chosen to really engage this material, you will find yourself much more advanced than other therapists out there. And that is a good thing. What, just got feedback? Okay, we're good. Okay. And that is a good thing. So, this chapter, I was really pleased when I had not read this chapter, by the way, until a couple days ago. And then I actually just skimmed over it, but I was shocked to find that it said all the stuff that I've been saying all along. I mean, none of this material to me is new. We have mentioned this all in some way or another during this entire course. So this is our chance to kind of review all that. But I mean, look at muscles attached to bones, they cross over joints and they shorten. And that's what creates movement. What have we been saying the whole time, right? Muscles attached to bones. We've been talking about that. Muscles can only do one thing, contract, which is shorten, and they create movement. That's what we've been talking about for months, so that's great. This chapter is divided into 12 lessons. First 3 are on bones and joints, and the next 9 lessons are muscles of particular areas, which I'm really excited about. So, let us just fly through that. This should be review for you too, and I don't mean that like, oh, if you don't remember, there's something wrong with you, but just like, we've been learning about markings on the bones because those are in general places where tendons attach to and ligaments attach to, right? Yep. What attaches muscle to bone? Somebody?
Tendons.
Tendons, all day long. What attaches bone to bone?
Ligaments.
Ligaments, thank you. And I saw some people mouthing it too, thank you. Okay. Now, we've actually learned a lot of these terms. When we first started, you guys were overwhelmed with this stuff, right? But there are bony markings, projections, all sorts of places that we think are kind of important. Can anybody think of an angle that we talk about sometime actually has the word angle in it? Think of a bone that we sometimes talk about the angle of. Yes, Miss Monreal.
Like superior angle of whatever.
The?
Oh, what you wanted a specific scapula?
Yes, the superior angle of the scapula. And what muscle has an origin, or an insertion, I don't know which way it goes. Actually, I guess it's insertion. Has an insertion on the superior angle of the scapula. Think about it. I feel like Miss Yana's kind of knows. Kind of, no?
I was gonna say the deltoid, but
Nope, but close.
the bicep?
Superior angle scapula is back here.
Levator scap.
Yes, levator scapula. Yes, very good. Cool, cool, cool. Can somebody tell me where we use the word border?
Lateral border.
Lateral border of what, sir?
Scapula.
Scapula. And what? I can actually think of 3 muscles can be found on the lateral border of the scapula. But at least 2. Depends how you define it. Can you tell me anything that's found on the lateral border of the scapula?
Teres group.
Yeah, really good answer. Thank you, Mr. Kandaris. The teres major and minor are found on the lateral border of the scapula. Yeah, very good. And the long head of the tricep inserts the lateral border of the scapula. Very, very good. Where we hear the term condyle? Who can tell me about condyles? Condyles. Somebody, I mean, I love hearing from Miss Monreal, but anybody else want to answer besides her? Anybody? Condyles. Think of a bone with a condyle. Yes, Miss Stanley, yes, please.
Okay, I really don't know how right I could even
worry.
closely be, but I'm gonna try my best to describe at least where I see it usually.
Yeah.
Isn't it usually like on like the head of a specific bone? Like I know there's one on the like.
It's at the
What
end.
is it?
It's at the end of long bones. So
Yeah,
that's
like
along
at the
like
end
your
of, like, a
humerus
femur
or your
or
femur.
humerus?
Yeah. These, rub the sides of your elbows, everybody. Those are condyles, or epicondyles if you want to get really picky about it, but those are condyles. Yeah. Yeah, very cool. And leading up to those condyles are crests, right? And the tips of them are epicondyles. But anyway, that's all very good, yes. Where do we use the term head? Is there any bone that has a head on it? Yes, Miss Cooper, tell us.
The head of the femur?
The best answer I could think of, the head of the femur. Also head of humerus, but head of the femur is fantastic because it really looks like a head. That's exactly right. The head of the femur inserts into the hip, into the acetabulum, which is your hip hole. Yes.
Epic.
Epic. Thank you. What are you grateful for today, Miss Cooper?
Well, it's hard to be grateful right now.
Okay. What about the wonderful answer you gave right when you slid into class?
Yeah, I guess I'm grateful for that.
That's pretty cool.
I'm very upset because I'm very specific about how I set my alarm and it didn't go off or I didn't hear it.
If that is the worst thing that happens today, it's going to be a great day. And we just started the lesson, so you're here perfectly on time.
All right, nobody's mad, right?
Nobody's mad, and you've been brilliant already.
Okay, because I was like hiding in throne.
You're fine, my dear. Don't worry. I really mean that.
Okay.
Anybody give me an example of a ramus? Where have we used the word ramus before? Yeah? Anybody? Ramus? Yeah, sorry, I just walked away to get something here in case I need an example here. Miss Montreal, ramus. No?
Is it like the circle things like on the ischium? Is it the inferior?
Yeah, the arms, right? You've got the superior ramus of the pubis, the inferior ramus of the pubis, and then the ramus of the ischium back here that meets this inferior ramus of the pubis and makes this hole, right? Yeah, cool. Yeah.
I do have a question about like the aponeurosis sheath.
Yeah.
If I can ask you later, well, I don't have to ask you later. But if you're gonna go over it, if you could give me an opportunity to ask.
Sure. But what's your question? Because I don't. Just ask.
Okay, so we have the sheath tendon on the lumbar area, correct?
Yeah.
Okay, so does that, as far as like the flat bands of fascia, does that attach muscle to muscle? And I'm like thinking of the frontalis and the occipitals. Is that the purpose of it, or does it actually like attach to bone? I mean, I guess if it attached to bone, I don't know. I'm a little bit confused, but not confused. I guess I just want to be specific.
No, I know. So it's hard being a little bit specific about the thoracolumbar aponeuroses because the fact is it weaves into almost everything in your your lower thoracic region and your lumbar region. But it does have muscle that weaves directly into it, and it itself does attach to the crest of the ilium, the sacrum. So it attaches muscle to bone.
Okay, so it does. That's what I wanted to know.
Yeah,
So
and it attaches
what
to your
about,
spine, your spinous processes too. It kind of weaves in everything back there. But yes,
Okay.
yes.
So what about the aponeurosis sheath? Does it float above the skull, or does it end up attaching somewhat to it?
I don't know. I mean, it definitely floats in the skull. That's the reason I can do this. That's my aponeuroses moving, but I don't know if it's a little bit stuck under there in certain areas, and if it's supposed to be. I'm sure it probably is anchored a little bit to the skull too.
Okay. And are those going to be the only two flatness fascia things, or
God,
are there others?
You ask really good questions. Okay, there are three major aponeuroses in the body. There is, in the lower back, the thoracolumbar aponeuroses. In the front, the abdominal aponeuroses. And then, as a shower cap, the gallia aponeurotica. But these two are really important, the abdominal aponeuroses and the thoracolumbar aponeuroses, because they tie together your midsection where there's nothing there to tie together, right? Like, that's what keeps your low back stable. So that's how the abdominals kind of tie into the low back, and the low back ties into the abdominals. So the two to really remember are the the thoracolumbar aponeuroses and the abdominal aponeuroses. Good question. Great question. Cool. Can anybody give me an example of a spine? And I don't mean your spine, but things that we call spines because they stick out. Miss Balatic, please.
Wait, do you mean like? Sorry. So okay.
Don't be sorry. Just say what's ever on your mind, and if it's not what I want, we'll talk about it. Don't worry.
Okay, well, I was thinking like the spiral of a notebook is called a spine.
Oh, you. By the way, you're absolutely right. I did not
Is
phrase.
that what you were asking?
I meant, is there a thing that sticks out on a bone that we call
Oh,
a spine, and can you name one?
I
love
thought you
that,
meant
though.
like, think outside the box.
I did, and you thought like way outside the box. It was good. Do you want to answer that question, or you're like, forget it? I got the notebook thing. Tapscott, I'm out.
Withdrawal from it, but
Okay, cool.
yeah, I'm good.
Thank you. Miss Moore, you have your hand raised for spine. You're going to give me an example of spine. Kind of a spinous
process.
Yeah, spinous process is one, right? These things that stick out the back of the spine. Yes, can somebody give me another one? Miss Stanley, please, hit me.
Spine of the scapula.
Spine of the scapula. I'd forgotten about that one. Can you believe I had forgotten about the spine of the scapula? Which is what your deltoid attaches to. Can somebody give me another spine? Miss Hunter, yes.
Is it iliac spine?
Iliac.
Did I do that wrong?
Well, you are close. The iliac crest, when you travel forward, runs into two spines, and when you travel posterior, it runs into two spines. Can you name those four spines that come off the iliac crest in front and in back?
Is it the ASIS? Oh yes, okay. And the PSIS?
Yep. And the AIIS and the
AIIS,
and the
PII.
PIIS. Yes. So what do those fancy letters stand for?
Anterior, inferior. Oh my God.
Iliac.
Iliac spine. Yes.
And then anterior superior iliac spine.
Right.
And then posterior
Posterior, inferior. Right? No.
Yep.
Oh. Inferior iliac spine, and then posterior superior iliac spine.
Yeah, and let's talk about these for a second. You guys will probably never feel, I don't mean it like I would, and I'm so amazing. None of us will probably ever feel the posterior inferior iliac spine. It's way down here. It's very close to the sacrum. It's very hard to tell the difference between it and the sacrum. Don't even worry about it. But we love finding the posterior superior iliac spine in back here, right? Because it lets me know where a particular joint is found. And what's the joint that's right by this guy?
You're not asking me, right?
At this point, Miss Hunter, I'm asking anybody. What's
What's
the joint between the sacrum and the sacrum between the sacrum and the ilium?
Sacroiliac joint.
Sacroiliac joint,
Yeah.
where your entire upper body goes down to your entire lower body. Yes, cool. What famous muscle attaches to the anterior superior, I'm asking anybody, anterior superior iliac spine? Famous muscle, not in a muscle group. Yes, Miss Petrie.
Is that the greater trochanter?
No, this is the greater trochanter, but I want a muscle that attaches here. A
Oh, I
muscle.
thought you were pointing at the
I know.
bone.
This is the greater trochanter. I don't blame you. It's very hard to see in the thing. This anterior superior iliac spine, what muscle? Yes, Miss Yanas.
Is it the piriformis?
No. Piriformis, back here.
Okay.
In front. Yes, Miss Stanley.
I feel like I'm way wrong, but is it gluteus maximus?
Yeah, with all due respect, you're way wrong. That's back here.
Yeah.
That's okay. I want Miss Harper, I know you have the answer. What is it?
I just want to try if it's like the muscle in the front, right?
It's in front because this is anterior. It's the most
kinda like-
superficial muscle of the thigh.
It's kind of like the sartorius or something.
It's not kind of like the sartorius, it is the sartorius. It attaches to here. What muscle, Miss Harper, attaches to the anterior inferior iliac spine?
Oh, is that the rectus femoris?
Yes.
Oh.
And that was our smart, because when you're a massage therapist, that's why you rub up all the way into the hip. Brilliant. Thank you. Miss Petrie just showed us, by the way, the greater trochanter. Remember the lesser trochanter underneath here? What two muscles that are super duper important insert into the lesser trochanter that are inside your body? Yes, Miss Torres. Okay. Yes, Miss Monreal.
Sorry, I'm having problems with my internet.
It's okay.
I'm gonna let her answer.
Well, okay. So what's the answer, Miss Torres? I don't know if she can, Miss Monreal.
Honestly, I can't hear you. Sorry.
Okay, don't worry. We'll try to fix your internet. Miss Monreal, what hooks to the lesser trochanter on the inside of the leg in here? Two muscles. We call them by one name.
The iliopsoas.
The iliopsoas, yeah. What is the main action of the iliopsoas, the iliacus major and the psoas? Come on, it's in front of you. What's the main action?
Well, okay. So hip flexors.
Yeah, it's hip flexor. It allows you to bend over. Yep. By the way, everybody, those of you that are young won't know this, but those of us that are older will remember that they used to have us do sit-ups in the gym. And then when you started going to personal trainers, they now don't have you do sit-ups anymore, they have you do stomach crunches. Because they started to realize how your body works. And they realized that, by the way, when I do a sit-up, yes, I'm working my abs a little bit, but what I'm really working is my iliopsoas, which is fine, but that's what it works. Stomach crunches work your abdominals, and that's all your abdominals do, which is why really good personal trainers who know their kinesiology have you do this. This is iliopsoas. This is rectus abdominis. Yeah? Yeah. Cool. All right. Moving right along. Are we having fun? No?
I think it's funny that you said that, like the sit-ups.
I'm sorry, what, sir?
I think it's funny that you said that about the sit-ups, because I kind of remember like when I was younger, they had us do sit-ups, and then as I got older, it switched to crunches.
Yeah, they were also worried to hurt people's backs and stuff like that. But really, the fact was, everybody's like, sit-ups aren't really a stomach exercise. They're an iliopsoas exercise. They're essentially like doing reverse leg lifts. It's the same concept. Your upper body comes to your lower body comes to your upper body. It's iliopsoas, which, by the way, is an important muscle to work, but it's not the purpose of the exercise. Yeah, I'm glad you remember that, sir. Can somebody give me an example? What does, by the way, the word foramen mean? Very simply put.
Isn't it the whole?
Thank you. It is a hole. So can somebody give me an example of a foramen?
Wouldn't it be like the ischium?
It is, but what do you call that hole there? So you're absolutely right. So you're referring to the ischium meets the pubis, and it makes this hole. What do we call this hole? There's a name for it, unfortunately. It's something foramen. It's something foramen, and there's two of the deep six muscles named after it. An internus and an externus. Oh, sorry. Miss Cooper, do you have the answer?
Yeah.
Sorry.
Obturator foramen.
Obturator foramen. And is there an obturator internus and obturator externus muscle?
Yeah.
Yep, they're part of the deep six. Yeah. You should show up late more often, Miss Cooper.
Get a little more sleep.
Can anybody give me an example of a fossa? Yes, Miss Nguyen. Miss Nguyen?
I
You cut out. Say it again, please.
I play about the
Say it one more time, please.
Oh, you can hear?
You're cutting in and out, so it's hard to hear you.
Okay. For me, so I play about the iliac posture and subscapular.
Yes, thank you. That's what I was hoping you were saying. So, fossa is just an indentation, and she talked about the subscapular fossa, right?
Yeah.
We've got an infraspinous fossa and a supraspinous fossa. Yeah. What muscles are found in these fossas, Ms. Nguyen?
Muscle. You wait me 1 minute.
You know. What muscle is found in the subscapular fossa? It's a rotator cuff muscle.
Wait 1 minute. Muscle. Scapular.
It's got the word in it, by the way. All these have the word in it.
I don't know how to say levocapular.
Not levator scapula. Subscapularis. Subscapularis.
I don't know.
Subscapular
Subscapular in the library. I don't know.
So subscapularis.
Okay, subscapular lavis.
Yeah, subscapularis is in the subscapular fossa. What's in the infraspinatus fossa? Oh, actually, I just said it. Infraspinous fossa is the infraspinatus muscle. What's in the supraspinous fossa? Say supra.
No.
Supraspinatus. You said it.
Yeah.
It's close enough. Good.
Yeah.
Good. Those are 3 of the 4 rotator cuff muscles. Yeah. Yeah. By the way, everybody, anytime I say infraspinatus, you say...
I say in the tenor minor, I don't know that.
Yeah, actually, I think you just said it. Teres minor. Anytime I say infraspinatus, you guys say teres minor.
Yeah.
It's the final 4 of the rotator cuff muscles. Why? Somebody tell me why. Why anytime I say infraspinatus, you say teres minor, or anytime you say teres minor, I say infraspinatus? Why do I put those 2 muscles together?
Because don't they run together?
They do. They're found in the same location, essentially. By the way, you can get really nitpicky and argue against this, but they run the same location, they attach the same way, and they do the same action. And from a massage therapy point of view, this is how they look. And it's very hard to tell the 2 apart. Yep. Anytime I say teres major, you say what? Yes, Miss Giannis?
Latissimus dorsi.
Yeah. Why?
Because they do the same action and are close together.
They both reach underneath the arm, they both grab in front here, and they both do the same action. They both cause a medial rotation, they both cause an extension or an adduction of the arm, and they're both kind of found together in the axillary region. I realize the lats go way down here, but they're both found right up here, and they're very hard to tell apart. Yep. Good. Cool. Yes, Miss Monreal.
So would you refer to those as synergists, or, I mean, because they do support each other, but they're actually doing the same thing, so they're not helping the other one, because they're doing the same thing.
Yeah, your question is too smart for me. I'm not being sarcastic. I meant, I guess I would call them synergists, but I realize I don't know the full definition. Synergists are helper muscles. So I guess what I would call the teres major, the synergist of the lat, and maybe the teres minor, the synergist of the infraspinatus. But they're definitely they're definitely synergists, actually. I was just trying to think of the exact definition of a synergist. But they're helping each other. Yeah. They're working in synergy. Yeah. Okay. Do we remember the axial and appendicular skeletal system? I love your honesty. Some of you are like, not exactly. Yes, Ms. Monreal.
Yes, is it the axial is like the head and the spine, and the appendicular is the arms and legs?
Yep, the appendicular is your appendages. But I want you guys to look at something here. Look at me for a second. So the axial skeletal system is my head, my spine, and my rib cage. It holds my heart, my head, all the important stuff is right in here. The other stuff is meant to work around it, even my hips work around my axial skeletal system so I can walk places, right? And then my arms work around my rib cage so I can grab stuff. So the axial skeletal system's here, and the other stuff kind of works around it. And that's how I'm put together. That's why they make such a big deal out of this. You've got an axial skeletal system that's the axis, and then you've got the stuff that works around that axis. Think about what my scapulas really do. They actually slide around my rib cage. When I retract and protract, they're sliding around my rib cage. Yeah. Okay. Good. Let's talk about the bones of the upper extremity. Cool? Cool, cool, cool. All right. Ms. Torres, how's your internet?
I'm using my phone now.
Cool, I love it. So can you see me?
Yeah.
Cool. Let's make sure that we can get it. All right. What's this bone right here?
The clavicle.
Yep. What's this bone back here?
The scapula.
Yep. What's this bone right here that I'm holding?
The humerus.
Yes. We haven't done this a lot because we haven't gotten to this part of the body yet, but there's two arm bones. What's the one running to the thumb called?
The radius.
Yes. What's the one going to the pinky called?
The ulna.
Yeah. And by the way, the ulna, everybody, is what makes your elbow. We'll learn this later, but that's your ulna attaching to your humerus. That's really what makes your elbow. Cool. We have not talked about this at all, but since we're in this section, we should talk about it. Do you know what these 8 little bones are called? This group is called?
Carpals.
Yeah, you're right. Do you know what these, I'm not expecting people to know this, we haven't done this yet, but do you know what the bones are above the carpals called? Take a look at
They're
this.
not phalanges, right?
No. Well, no, they're not. So, look at the slide. After carpals comes...
Oh, I'm not looking at the book.
Well, what about the slide? Yeah.
Okay, metacarpals.
Yeah, and then these are what?
Phalanges.
Thank you. Good job. Okay. Cool, I just want to make sure we know what bones we're talking about, right? Cool, cool, cool. All right, so let's make sure that we're all on the same page here. Miss Blodek, what's this bone here called?
The clavicle.
Cool, thank you, ma'am. What's this triangular bone back here called?
The scapula.
Cool. What's this arm bone here called?
The humerus.
Yes. What is the bone here in your forearm that goes to your thumb called? Starts with an R.
An R.
Uh-huh. An R is in rad. Could be on the slide.
A radius.
Yes. What's this bone here called that goes to the pinky and makes up your elbow?
Ulna.
Ulna. Thank you, ma'am. All right. That's cool. Thank you. That's perfect. Perfect, perfect, perfect. Okay. Let's take this one step further. Boom. All right. Got a nice little slide there. Boom. We're not going to worry about this. That's ridiculous. Okay. Miss Petrie, what's this joint here between the sternum and the clavicle called?
Sternoclavicular joint.
Yes, ma'am. It is. What's this joint between this acromion process and the clavicle called?
Acromion process and the clavicle. Oh, it's on the slide. Oh my God, I'm trying to think, and it's right there in front of my face. Acromioclavicular joint, the AC joint.
Thank you, ma'am. Thank you. Cool.
Sorry.
Don't be sorry. We're just having fun. It's fun to laugh at ourselves. Come on. We're all goofy. Very cool. Miss Hanson, this is not on the slide. What is the one joint that is by the way, there's other things that hold my shoulders onto my body, but what is the one joint that attaches my entire shoulder girdle complex onto my body?
Is that the acromioclavicle? Or the sternoclavicle?
Sternoclavicular, yes. Right here is the only joint that attaches your stuff on here. We think these scapulars are attached on back because they've wired them onto the skeleton. They're not wired onto your body. There's muscle that helps hold them here, but unlike your other limbs, the only thing is this tiny little sternoclavicular joint that attaches your entire shoulder girdle onto your body, which is why it can move around so much. It can, I mean, you think about it, this guy can touch this to his head, almost, right? It can go way up, it can come way down, it can go way forward, way back, and that's because of the amount of movement that's right here. But the strength doesn't come from here. There's not enough strength here to hold this thing together. That's the only joint that keeps you all together. Yes. Okay. And they call this whole thing the shoulder girdle. I call it the shoulder girdle complex because it's this complex of movements. But that's the shoulder girdle we've all been talking about. Good.
So the upper extremity, so lesson 1, the bones of the upper extremity, that is all called the shoulder girdle.
Well, the bones of the upper appendicular skeletal system, but we haven't talked about the ribs are part of the upper extremity too. And the skull is too, and all that kind of stuff. But I guess upper extremities, yeah, I guess by extremities they probably mean appendicular. So yeah, shoulder girdle complex. So clavicle, scapula, humerus, radius, ulna, carpals, metacarpals, phalanges, yeah. Okay, yeah.
I'm confused.
Well, I don't know that you need to categorize this the way you're categorizing it. What you do need to be able to do is do this. Miss Petrie.
But you're saying that the sternoclavicular joint attaches the entire shoulder girdle.
It does. It is the only joint that attaches this appendage, all right, this whole thing. The only place it's hooked to your body via a joint is the sternoclavicular joint. There is no joint here in back. Your scapula, okay. If this wasn't a skeleton, the scapula would be laying on the floor. They've wired it onto the back here.
Okay.
So this is the only joint. It's hard for us to imagine because it's held on really well with other muscles, but this is the only joint that attaches all this on here. And also, I don't even care if you know that. I really don't. That was just a fun fact just to kind of mess with Miss Hanson. But I do care that you can like name this bone and name these joints and name this bone and that we can talk about the muscles that we're about to talk about.
So then what is the shoulder girdle consist of?
What?
What does the shoulder girdle consist of?
Actually, just the clavicle and scapula.
Okay.
Right? Now, then the arm hangs off that, but the shoulder girdle is just the clavicle and scapula.
Okay, I think that's where I was confused.
Sorry, it is confusing.
No, it's not your fault. I think I was
It probably is this time.
making it more confusing on myself than it actually is.
I feel like you understand this part. I feel like you understand better than you think you do. Like you understand what I want you to understand, which is this is a clavicle, sternoclavicular joint, a acromioclavicular joint. This is the scapula. The arm hangs off the scapula floats around, that kind of stuff. Cool? But hang on, because we're about to talk about this shoulder girdle complex, right? All right. So bear with me, everybody. I'm going to actually go through these bullet points here and ask you guys to identify this stuff, basically. Miss Yanez, what's this right here?
The medial border
Yeah.
of the scapula.
What's this?
The lateral border.
Thank you. Absolutely. Miss Stanley, what's this down here? If you can see it.
I think that would be the inferior angle.
Yep. What's this way up here?
Superior angle.
Yep. Scapular scapula? Does anybody know what scapular scapula is? I think it's got to be a misprint. Yeah. Miss Montreal, your hands up.
No, my bad. I didn't know it was that.
Oh, that's all right. What's this, Miss Montreal?
Spine of the scapula.
Thank you. Miss Nguyen, what's this process at the end of the spine of the scapula? What's this process that makes up kind of my shoulder pad here? This process, Miss Nguyen, right here. Spine of scapula turns into it. Miss Nguyen, where did you go? Thank you.
I'm here.
Good. So what is this? What's this process that comes at the end of the spine of the scapula? It's on the slide, by the way. I'm just kind of going in order.
I think in the infrapinal fossa.
Well, that's down here. This fossa is down here, yes. This is the acromion process, though.
Oh, corium. Oh, okay, corium fossa. Oh.
No, not just
No,
a chromium process.
Supra in the pinal.
Stop!
Pinal.
You're right. I mean, that stuff's close by, but I just want you to say acromium
Purium
process.
fossa.
Thank you. Hold on. You've got one more process coming. What's this beak-like projection that reaches out underneath your collarbone? It's this little sucker right here.
I think.
And it's in the slide.
Korea, I don't know. Korea, the posh. I don't know how that.
Coid.
Coid, yeah. Korea, coid.
Yeah, coracoid process. Good job.
I don't know how to talk that, but I know that.
You just did it. We're good. We're good. Thank you, ma'am. Miss Felix Osuna. Inside the joint here is this little fossa or cavity. Some people call it a cavity. Actually, your book calls it a cavity. But what is this called? It's where the head of the humerus attaches here.
The glenoid cavity.
Glenoid cavity, right? Which makes what does that make this joint between the glenoid cavity and your humerus called?
The glenohumeral joint.
The glenohumeral joint. Massage therapists use that term because they want to know if they're talking about this ball and socket here, if they're talking about the joint up here, or the scapula moving around up here. The glenohumeral joint is this thing. By the way, everybody, remember your glenohumeral joint can only go up that high. Remember, you hit the acromion process right here. You could not lift your arm above your head if you didn't have the scapula then move up. Right? I can actually only bring my arm out to here. Watch. Only bring my arm out to here before. Watch what happens with this finger right here. It now has to come up. I can't get past here without my finger coming up. Try it. You can't do it because what happens is you hit this chromium process and then the whole scapula has to come up. That's how shoulders work. That's why they're so amazing. Can you imagine if you could do this with your legs? I mean, even really, really flexible people have a very hard time doing this kind of stuff. And that's because the you're not only getting a ball and socket here, but when the ball and socket runs out, you get more movement of the scapula. Cool. Okay, where was I? Miss Moore. Miss Moore?
Yes.
What bone is this right here?
The scapula.
Thank you, ma'am. What do we call the fossa above the spine of the scapula?
Wait, I know it.
You're right there. Supra.
Yeah, I know it. I just can't get the word.
Supraspinous.
Yeah.
So say it.
Supraspinous. Is it a fossa?
Yep, supraspinous fossa. Then what's this fossa? You're doing great, by the way.
No. No, it's not infraspinous fossa.
It is. It's below. Yeah, below the spine. It's infraspinous fossa. And then what's the one underneath the scapula called?
Infras? No, I already said infra.
What do you call a boat that goes under the water or a train that goes under the ground? What's the word for under? What do you call a boat that goes underwater?
I don't know. Let's see. Wait. Damn, what? Subscapularis?
Subscapular fossa, yeah. Good job. Good. Good. Hang in there. That was good. This is what I want you guys doing. Is like trying to pull out information. All right. This one is for $1 million. Because I want to ask. There's inside the glenoid fossa. There's a tiny tubercle on top and a tiny tubercle on bottom. Who can tell me what their names are? That part, I think. Okay, Miss Cooper, go ahead. What are their names?
Well, I mean, one of them is the glenoid tubercle.
Well, okay, they're both glenoid tubercles. Which one's the one on
Oh,
top?
I thought that's just what it was called. I'm so sorry.
Don't be sorry. What's the one on top? What do you suppose the glenoid tubercle on top would be called?
The superior.
Pretty darn close. Supraglenoid tubercle. So what would the one on bottom be called?
Glenoid tubercle.
You just cut out. Say it one more time.
Infraglenoid tubercle.
Yeah. Supraspinous fossa, infraspinous fossa, supraglenoid tubercle, infraglenoid tubercle, right? All right, but that wasn't $1 million question. You did excellent, Ms. Cooper. But open for anybody.
Woohoo! What do I get?
Open for anybody. What muscle attaches to this one, and what muscle attaches to this one? Because they actually have tendons that run inside your joint and attach there. $1 million question. One is found on the anterior side of the humerus, the other one is found on the posterior side of the humerus. Miss Harper, tell us. Come on. I saw you go, oh. Yeah, come on. Do it.
It's not the coracoid brachialis or
No, it's not the coracoid
the
brachialis. The triceps in back, the long head of the triceps in back attaches underneath
the
here. And the other one is the long head of the biceps brachii. They're actually, biceps brachii actually has a long head that goes up into your socket in there and attaches up here. It's crazy. Good. was the $1 million question. That one's, don't worry about it. But I owe you $1 million, Ms. Harper, so don't let me forget. We'll talk, maybe electronic transfer, because that's a lot of cash just to give out. Cool, cool, cool. All right. This is a beautiful picture, by the way, of all the stuff on here. Wow. Okay. Good. Good, good, good. So, real quick note here. What your book says about this is this joint right here, the glenohumeral joint, sacrifices some stability to get some mobility. And what that means is it's not a super stable joint, but that's what lets it move all over the place. Your hip is more stable, but your hip can't move quite as much, but boy is it inside a socket, so it's really in there. So what's the problem with that? I get lots of shoulder movement, but it's really easy to dislocate my shoulder. It's why cops, when they arrest you, put your arm behind your back. When they lift that arm up, it forces the head of the humerus out of the shoulder socket, and it doesn't quite come out yet, but you know subconsciously that's what's going to happen if they keep lifting your arm, and that's why you go along peacefully. And if they were to keep lifting it, it will come out of the socket. Yeah, and then you got to pop it back in. And that's not pleasant, either one of those, and you can tear stuff. Yeah. Okay. Let's see. What do we want to say about this? Okay. Miss Hunter, there's a bump on the side, on the lateral side of my humerus. Right here. It's a tuberosity. Do you know what it's called? And the answer is up in the slide somewhere.
It's on the deltoid.
It is.
Is that the deltoid?
Well, the deltoid is on it, right? This is the humerus. That's the deltoid tuberosity.
Yes, deltoid.
And the deltoid comes down and attaches to that, right? Deltoid tuberosity. Mm-hmm. Everybody, that's how it's able to lift up the arm and move it around and stuff. Cool. All right, cool. I was just trying to pick out stuff there I thought was important. All right, moving right along. We're not going to get into this too much, everybody, but we will later. By the way, we're getting into this. We're going to do a whole section on your elbow, your forearm, and your hands, but we're not there yet, and your book's already discussing it. So I just want to drop a quick note here. Your elbow joint, what gives it strength is the connection between the humerus and the ulna. That's what gives it humerus. And we call this, what would we call this joint between the humerus and the ulna?
Glenohumeral joint.
Well, hold on one second. You were about to say something, Ms. Jonas.
You said between the ulna
and the humerus. Yeah.
Humeral ulnar?
Yeah, humeral ulnar joint. That's your elbow. Technically, that's your elbow. This is your glenohumeral joint, and this is your humeral ulnar joint. Now, you'll sometimes hear people refer to the humeral radial joint, but that's not what gives your elbow stability. Your humeral radial joint lets you do this. It lets you turn your hand over. It literally is the thing that at your elbow rotates. That's why they call this the radius, because it rotates and lets it flip over. We will study an entire chapter on this later. I just thought we should throw it in now so it makes sense if you read it in the book. This humeral ulnar joint is a hinge joint. The humeral radial joint is a, I don't know, pivot joint, axis joint, something. Lets it rotate here. So, just a little side note. Okay, we're not going to get into all that yet because we're going to do it later. We're not doing the carpals because we're going to do those later. I promise we're doing all this stuff later. We've talked about carpal tunnel. We'll get to that later when we get back to it. Okay. So, now let's talk about, Ms. Petrie, by the way, you're right. They're using the word extremity to mean appendicular. So your appendages. So we just did the bones of the upper appendages, right? Which is really just your collarbone, your clavicle, your scapula, your humerus, radius and ulna, carpals, metacarpals, phalanges. Now we're gonna do your legs, right? Your hips, your thighs, all that kind of stuff, right? Let's not get all nitpicky here. Let's talk about this. Okay. Mr. Kandaris, the hip is made out of 3 separate bones. What is this upper bone? Mr. Kandaris?
Yes, sir.
What's this upper bone?
I was looking at your chart. Point at it again.
This bone, right here.
The ilium.
Yes. What is this bone back here called? Backside? Ischium. And what's this bone back here, this bone here called?
Pubis.
Pubis, thank you very much. Everybody, do you see in the slide they're colored 3 different colors? Do you see that they come together in your hip socket? Your hip socket is called the acetabulum. When you were a little baby, I actually don't know if this happens when you're in the womb or out afterwards, but when you're really young, those are 3 separate bones and they fuse together right where this picture shows. They fuse together and they make the hip socket then. So they're 3, that's why we call them by 3 different names. They were 3 separate bones at one time and they fused together to make that hip socket. So those colors actually show the 3 separate bones. It's kind of cool. Yes, Miss Monreal.
Is that because like the babies are all squished up in the tummy? Like so?
Well, this is the part I'm embarrassed about. I should know when they fuse. Different stuff in your body fuses different times, and I honestly don't know. We could Google it right now. But that would be my guess, Ms. Monreal, is it would make birth easier if those bones were not fully fused at that point. And I bet you they're at least cartilaginous when you're born, which means they've got a lot of play in them. And I know that there's lots of stuff that says the crawling process for kids kind of helps all that kind of align up and everything like that. But yeah, they're 3 separate bones and then they finally fuse together. By the way, a lot of the stuff when it's not fused is still connected by cartilage. But in all of you now, no more cartilage, it's solid bone. If we took you apart, you would look like one big hip bone. You wouldn't have those 3 different colors there, right? It'd be all fused. Yeah? Okay. Was there more to that question, Ms. Monreal?
No.
Even though I didn't answer it? Hold on.
Well, we kind of did.
Bones fuse. Let's find out. Hold on. Oh, yeah, Miss Monreal.
Yes.
There is cartilage between the bones. By the way, I'll be very honest with you guys, I never knew this until 2 seconds ago when I just Googled it. But there is cartilage, I mean, I knew the cartilage part, but I didn't know the name of it. There's triradiate cartilage between the bones because the reason there's triradiate cartilage between the bones is it's going out in 3 different directions. It's radiating out in 3 different directions, triradiate cartilage. And that cartilage is there at birth. In fact, it doesn't fully calcify until around age 17. So,
wow, that's super interesting.
Yeah, so the cartilage is really strong. It holds it together, but as you become a full adult, that's when it fully turns into bone. Yeah. So it's forming through puberty and such. Very interesting. I didn't realize it was so late in life. I would have guessed age 3 or something, but anyway, it's more like age 17. But
yeah, that's kind of what I thought, like maybe by the time they were toddlers, but that's super interesting that it is so late in their adolescence,
Yeah. Now, by the way, cartilage is really strong stuff. I mean, you've got cartilaginous connections here in your skull that are almost rock solid, but still, yeah, it would still have flex and everything, and it hasn't calcified fully. But now, if you looked at an adult, you would no longer be able to see that, and it would look like one bone. Cool. All right. Yeah. Keep stretching, Miss Cooper. Make room for the new information. Okay, so we said 3 fused bones, right? Your hips are confusing, by the way, because people refer to them by different names, by the way, just to warn you. Many massage therapists never call them hips. They always just talk about the particular bone they're talking about, the ilium, the ischium, or the pubis. Other people call them the coxal bones. Then they're referring to all of them. Some people call them the hip bones. Yeah, pelvic, hip, coxal, ilium, ischium, pubis. All of those are kind of used interchangeably. The most precise stuff to use, by the way, is ilium, ischium, and pubis, because it tells us where you're talking about on the hips. Okay. The hole in your hip, deep, you can't see here because there's a ball and socket in it, but the hole is called the acetabulum. What's this big bone that comes out, largest bone in your body that comes out of there? It's sawed off here, but what is this bone? Yes, Miss Monreal?
The humerus.
No, Miss Monreal. That is
No?
incorrect. What is, you're cut
I
off.
mean the
You're
femur.
cut off. You're
I'm
cut
so
off.
sorry.
Nope, that's it.
The femur. I'm so sorry.
The femur.
Like, what do you mean? It's okay, yeah.
The largest bone in your body is your femur. Everybody's hand should have been up at this point for this one. Your femur.
I was trying to be humorous.
Yeah. I'm going to beat you with a femur. It is the largest bone in your body. It's where the majority of your red blood cells are produced and white blood cells. And it hooks into your acetabulum to create what joint? What would you call a joint between your acetabulum and your femur? Which is your hip joint, by the way. What would we call that joint?
Acetabulum femoral joint.
Acetabulofemoral joint, yeah. By the way, some people just call it the coxal joint, which means the hip joint, but acetabulofemoral joint is the correct term. Remember, we always name joints by what 2 things come together. Yeah. Cool. We've talked about pelvic tilts quite a bit in this class, have we not? When the top of my hips are going forward, what do we call that tilt?
Anterior tilt?
Anterior tilt. Hey, look what happens when I tilt anteriorly. What happens to the bottom part of my hip?
Goes up.
Yeah, it goes back. Yeah. That's why we talk about it from one place only. We kind of pick the top and we say that goes anterior. What happens when my anterior hips tilt back?
Posterior.
Posterior tilt. And look what happens to the bottom. It points out. That's why we have to choose a place to talk about it. So when the top goes forward, anterior. When the top goes back, posterior. What is this tilt?
Lateral.
Yes. What is this tilt?
Medial.
It's lateral also.
Lateral.
They're both lateral. I just threw it there. I like how you flipped it there, though. That was good. That's good. Okay. All right. Pelvic tilts, yes. I guess your book is saying that you could call that like a right lateral tilt or left lateral tilt, depending on which side it's tilting to. For the client, not for you. Okay. This is the back side of the body. This is the sacrum. What is the joint between the hips and the sacrum that we've already talked about today, where the entire upper body connects to the lower body? What is that joint, please? Somebody.
Sacroiliac joint.
It is the sacroiliac joint. And what major landmark do I look for, Ms. Giannis, to find the location of the sacroiliac joint?
The sacrum.
Well, but I could be down here on the sacrum. I could be over here on the sacrum. I could be up here on the sacrum.
Where the hip and the sacrum meet, the ilium. Where they meet.
Yeah, so I could be here on the ilium. I could be here on the ilium. I could be down here on the ilium. I could be up here on the ilium, here on the ilium. What bump is right next to the sacroiliac joint?
Is it a trochanter?
That's over here. The joint's up here. That's over here.
Every sentence we have a sorry yes.
If I follow the crest of the ilium posteriorly, and I get to a bump here, what's this bump called?
Oh, is it the posterior superior?
Keep going.
Spine?
Yes. The posterior iliac spine, posterior superior iliac spine, everybody, is where you find this notch here. It's important because really advanced massage therapists actually get in here and loosen this up. And if Tapscott has time, he's going to actually show you this later in the course. But we have to be able to find it. And the way we find it on somebody's back is we feel for this bump, and then we know we go to the inside of that bump. Essentially, you can do this. Essentially, there's a lot of fascia here. But essentially, you can get your hands in there. As you come across them laterally, you find the posterior superior iliac spine. And that, if you reach in there, you are in the SI joint, sacroiliac joint. That's why it's so important. I mean, if you care about where the entire upper body connects to the lower body, but why care about that? Yeah. I mean, it's only the most major junction in your body. Yeah. Yes, Miss Monreal.
Can we take a break soon?
Yeah, let's take a break. I was just thinking it in my head. It's funny you say that. Okay, let's take a break, everybody. It's a very important bone. On your foot, the talus is underneath the tibia. The talus is this bone right here that kind of acts as the centerpiece for your calcaneus and your metatarsals, all that stuff coming off here. It's this little ankle bone here. It's very important, and it's very powerful, but we just haven't gotten there yet. Yeah. Do I have to brush my teeth?
One, I was brushing my teeth. Two, I thought you said hallux.
Hallux?
Wait, no, pollux. Pollux is your thumb, correct?
Bullocks.
Pollux. What is
Polysis,
the
polysis and holosis.
Polluxes. What's the big toe thing?
What's the big holosis?
Holosis, okay.
Yeah.
All right, well,
Yeah.
and I was
But
brushing my
it's
teeth,
good you're
so
brushing
I
your
hope everyone's
teeth.
proud of me.
It's good you're brushing your teeth in case you have halitosis.
Yeah.
All right. Cool. All right, so anyway, that's why I'm skipping over feet stuff, because we haven't really gotten to it yet. And we are going to study feet bones, because you know, guys know I'm obsessed with feet. So, we used to teach it like, well, anyway, long story. I actually have an anatomy course where we teach it very, very first, because it's that important. Okay. We've talked, though, about arches in your feet and how important they are, right? About this concept, about how they squish down. That's what your book's talking about here. We are moving right along. Don't worry, by the way, this is just overview on on bones, so that we can all remember that we don't remember anything about bones before we get to the muscles and talk about them. Yeah? Okay. So you guys can be like, wow, man. Okay. So that's kind of the legs and arms. Skipping the hands and feet. But that's legs and arms. Yeah. Just overview. Big picture stuff. Right? By the way, I will say, if you knew this entire chapter from front to back, 21, that would be the entire course. You really would. I mean, it wouldn't get systems to the body, but it'd be the entire course. The axial skeletal system. What makes up the axial skeletal system? Yes, Ms. Petrie.
The skull, the vertebral column, the sternum, and the rib cage.
Yeah. Cool, cool, cool. So, what are these vertebrae up here called? The ones in your...
Cervical.
Yeah! How many cervical do you have?
I want to say it's 5.
That's not what I want you to say. 7 is what I want you to say.
Okay, 7.
Good. And then what are these vertebrae down here? Below the cervical.
Thoracic.
Yeah, thoracic. And how many do you have?
12.
Yeah! How many ribs do you have?
12.
Yeah. And what are these down here?
Lumbar.
And how many lumbar do you have?
5.
Hey, you were absolutely right, by the way. What's 5 plus 7?
Oh God, no, I did math.
Yeah, just do it
8,
though.
9, 10, 11, 12.
Yeah, it just helps me remember. It helps me remember that for whatever reason, but there's 7 here, plus 5 is 12, and there's 12 in the middle. That gives you
Okay.
roughly 24 vertebrae. If you count the sacrum, which really is a vertebrae, that's 25.
Sorry, I still count on my fingers.
I count on my fingers too. Yeah, don't worry. Guess what? You don't have to be a good mathematician to be a great massage therapist.
Thank God.
Yeah.
I would fail.
Yeah. Astrophysicist, you need to be a great mathematician. Just in case you want to be an astrophysicist, but this probably won't matter. Okay. We
I don't
haven't
think that's a good fit for me.
astrophysicist?
Yeah.
I think it'd be great. I picture little pocket protector, put on your little glasses, compute numbers all day long, project curves in space with gravity and all that kind of stuff. Yeah, that'd be good. Probably only 8 more years of schooling too. Okay, it sounds like a lot of work, man. It's amazing, but still. Okay, we are not going to talk about the bones of the skull yet either, because again, we have a chapter on that. And so you might wonder, by the way, a couple of things right now, which you probably do. One is like, Miss Petrie is like, why didn't you dedicate more time to this chapter? But also, if we haven't discussed all this stuff, why didn't we put the chapter at the end of the class, right? After we had talked about hands and feet, after we talked about the skull. And the reason we didn't is because we felt like you had enough kinesiology now that you could start talking about kinesiology. And you'd see the importance of it before we got to all this other stuff. We didn't want to put it at the end because we're worried about if it doesn't make sense then it's too late. This gives us time to kind of bring it all together. So kind of we taught you enough that we could talk about kinesiology, and then you could be like, oh my God, I need to learn kinesiology, and we could talk about it more and kind of complete this course up. So there is a method to our madness. We're not going to talk about skull bones right now, but if you will have to learn them eventually. So put your hand on your forehead, just so you've heard them once before we ever do them. Like this, like, oh my gosh. Say frontal. Frontal, yeah. Say temporal. Temporal. Say parietal. Yep. Say, right here, believe it or not, it's hard to explain, but it's running through your head is your sphenoid bone. Sphenoid. Wow, you said it angry, like Ms. Petrie. Sphenoid. Right back here, occipital bone. And in here, ethmoid. Yeah, thank you. I just want you to hear them so that when we get to the skull, you'll be like, oh yeah, he mentioned those at least, and now we're going to have to learn them. Temporal bone, I think, is the most important one because it's got some amazing features. Anybody remember the amazing features of your temporal bone? Any of them? What do I care about my temporal bone? Several answers would do. Any answers at this point would do.
Temporal bone, that's like sinuses and stuff too, right?
Sure, I'll give you that, absolutely. So could have something to do with sinus headaches. Hold that thought. Miss Moore? Yes.
The temple of your head.
Yeah? Kind of along those same lines, sure.
So like for my like tension headaches. So
No, I agree. But there's a reason there's tension on this bone. There are several interesting features about this bone.
Doesn't it also have to do with the ears?
Oh, you mean there's a hole going right through it called the external
Yeah.
auditory meatus for my, yep, that's true. So that's one point. In fact, people that get jaw problems sometimes hear ringing in their ears because this is also what forms your jaw joint. What's your jaw joint called?
The mandible.
Mandible is your jaw bone. What's the joint here called that I'm using right now as I talk?
The mandibular.
That's the last part of it.
Temporal mandibular joint.
Yeah, TMJ, temporal mandibular joint. So that is an aspect of my temporal bone. So we've already identified two very interesting aspects. One is my ear is in it. My external auditory meatus, my ear hole is in there, and there's an eardrum in there. Right next to it is my temporal mandibular joint. You will have people come to you and talk about TMJ, temporal mandibular joint. That's two things. Miss Moore, did you have more? Miss Moore? Oh, no?
No,
Okay.
I was gonna say the same thing.
What did you want to say, ma'am?
No, I was gonna say the same thing she just said.
Ah, cool. I got you. Miss Harper, I saw you touching an area of your head that is kind of where I'm thinking of. Makes me wonder if thinking of the
I'm
same.
just thinking, like, because you have like the occipitals, you have muscles there, so yeah.
What's this bump right back here on the back of my temporal bone? There's a process there.
Oh,
What's that process called?
process.
Yeah,
I don't know.
it's in the slide. The bump on my temporal bone is somewhere. That answer is somewhere in that slide.
Like a sphenoid bone.
That is a tiny little toothpick one that's deep inside here.
Occipital bone.
Occipital bone is not a feature of the temporal bone. It's another bone.
So
What
it's
is
a
the-
temporal bone.
What is the process? The bump in the back of my temporal bone.
Zygomatic process.
That's my cheekbones, by the way. That's part of your temporal bone too, believe it or not. Your temporal bone comes forward here, and this is your zygomatic process, and it meets up with your zygomatica, which we haven't talked about yet. But that's your cheekbones. How about your mastoid process of your temporal bone? Does this sound familiar to anybody?
Oh.
Anybody? Mastoid process?
Yeah,
Back here.
it
Everybody
does.
touch back here. You should feel a really hard bony thing back there. That's your mastoid process. Your temporal bone.
Is it medial or is it lateral?
It's lateral.
Okay, the lateral one?
Yeah.
Okay.
We have learned 3 muscles that attach to that mastoid process. It can be a headache causer. That's why I'm making such a big deal out of it right now. 3 muscles that attach to the mastoid process, putting a lot of pressure on it. There's actually 4, but we've only learned 3. And what are they? Give me one. One muscle that attaches to the mastoid process.
The splenius capitis.
Splenius capitis is 1. That's the hard one to remember, Miss Harper. The splenius capitis comes being out from here, and yes, it gets along the nuchal lines, but it goes all the way out to the mastoid process. That's the splenius capitis. Actually goes out like this. So by the way, just so you guys know, just so you can see, if you've got this head here, with this spine here, hold on, I need something that'll show up. And these are the mastoid processes. She just talked about the splenius capitis. Triangulates out to the sides. I love that. Beautiful. Beautiful. What else attaches to the mastoid process? There's something on the anterior side and something on the posterior side. Something else on the posterior side, because Miss Harper got the hard one. I guess what you guys could do is you could think long and hard about it and you could pray. And maybe that will help you. Because that's what I would do at this point. to get those two muscles. I would think long and hard about it, and I would pray. That's a weird hint.
Is it the master glenoid? I don't know how to say
The
it.
master
So-
glenoid what? Are you making up words? Is it the
Yes.
goobly glock?
No,
Oh,
really.
wait, Miss Harper. I have no idea what you're saying. Really what?
Is that the longissimus or something?
Oh, think long and hard about it? You thought of the longissimus? Oh my gosh.
Yeah.
What's the most important spinal erector muscle?
Yeah.
The longissimus. What attaches my head to my butt? The longissimus. Yes, the longissimus. Goes all the way from my butt to my mastoid process of my temporal bones. Yeah! Bam! That was thinking long and hard about it, but I also said you might need to pray about it.
How about the spinalis capitis? No,
Well, you already did that one.
no, it's different. I know.
Did you? You said. I thought you said spinalis capitis. Are you thinking semi-spinalis capitis?
Maybe.
Don't. Stick with something in front. Miss Cooper, you have something in front for me? You've been praying?
Parietal?
Well, you have your hand up.
Yeah, I said parietal.
No.
Like, dang it.
You're adorable. Dang it. I'm not, well, I am ignoring you, Miss Monreal. I just want to give everybody else a chance really quick. I really appreciate your answering. Miss Stanley.
I can't remember, but where's splenius cervicis again?
In back.
It is in the back?
Kind of looks like spinalis capitis, kind of comes out, but it's spinalis cervicis, yeah.
Okay.
Miss Petrie, do you have your hand up, or has it just been left up? Anybody else? Come on, somebody else take a stab. You can't.
No, I don't have an answer for
Good.
that.
You can't go wrong because, I mean, you can go wrong, but we're all going wrong. So, what's the muscle in front that you should pray about that inserts into the mastoid process of the temporal bone and has the word mastoid in it?
Is that the sternomastio? It's hard to say that.
Sternocleidomastoid?
Yeah.
Sternocleidomastoid goes from the sternum, the clavicle, the mastoid process. It actually has the word mastoid in it. Sternocleidomastoid. Actually, and what happened? What's its nickname? SCM is one of its nicknames. What's the action of this muscle? With this muscle contracts, just look at it, don't look it up in a book. If this muscle contracts, what's the action going to be? It's in front of me.
Flexion.
Flexion. Like pretty much like every muscle in front. Not every, but pretty much. Flexion. So, what's the nickname of this muscle? Omnis Patris Spiritus Sancto.
Pray.
Prayer muscle. It bows your head down in prayer. That's why I said you had to pray long and hard about it. Sorry. But I have said that. It is the prayer muscle. It inserts in the mastoid process. Why is this important? Because it and the longissimus triangulate off your head and they can get tension back and forth. And they're pulling on the temporal bone, which is where your ears and jaw hook in, and that can give you headaches and all that kind of stuff. So it's kind of cool. Think about this for a second, everybody. This is kind of fun. Structural kinesiology. If I told you that we're going to build a tall tower in your backyard or off your roof, and that tower was starting to fall over, would you tie wires to just one side of it? You'd tie them to both sides. We call that triangulating, right? If you have a tall head that you're trying to keep up, what do? you triangulate it. You have wires that pull it in front, the sternocleidomastoid, wires that pull it in back. That balances it front to back. But wait, I have to balance it left to right. Splenius capitis, left to right, all hooking to the mastoid process. That would be mind-blowing if it was just happening here, but I can show you those triangles all over your entire body. All over your entire body. Remember the tensor fascia lata? Hooks in down here, then goes down the IT band. It's coming diagonally from here, hooks into the glutes from in back, triangulates. Obliques, what do? Triangulate. Triangle there, triangle there. Your whole body is just full of this stuff. I can give you 20 examples. You're a triangulating machine because you're trying to balance yourself. Why is that important? Because the triangles can fight with each other. My longissimus can get tight and my sternocleidomastoid tries to balance out in front. And now I've got tension here and in back. But most massage therapists don't know that, so they keep rubbing just the back of the neck and they never get the SCM. But you guys are going to remember that, which is why you're going to be better, which is why you're going to get paid more. Anyway, lots of important stuff attaches to the mastoid process, the temporal bone. By the way, lots of stuff attaches to the occipital bone back here in the middle, right? Like the suboccipitals and stuff like that. 8 little suboccipitals back there. Okay. Here's a great picture. In green, on the side view here, is the temporal bone. And we can see that the jaw hooks up into it. We can see the ear right behind it. We can see this little arm coming forward, which is called the zygomatic process, which meets the zygomatic bone, which is your cheekbones, right? So those of you need good pickup lines, you know, guys are like, nice eyes, things like that. I like to kind of do something a little cooler, throw them off a little bit. You need something kind of new. I'm like, nice zygomatic arches. That's your cheekbone, your zygomatic arches, you know? And usually after they throw their drink in my face, they go, what is a zygomatic arch anyway?
How do you even have a girlfriend?
I know. It's amazing. She's really sweet. She's not too bright. No, I'm kidding. It does make one wonder. It does. Yeah. It's funny you say that. My dad said I should marry her quick before she figures it out. I don't know what he meant by that. But anyway, I was like, thanks, Dad. I appreciate that. Okay. But she has nice zygomatic arches, by the way. I mean, I know that's a little personal, but I just got to share. Okay. Hey, we haven't learned about this yet, but you have a big hole in the bottom of your skull that your spinal cord comes out, because you got to hook your brain, right, to your thing. What do you suppose we'd call a big hole?
Foramen.
Foramen's hole, but I said big hole.
A big foramen. Haha.
What do you call a big caliber handgun? Big caliber handgun bullet.
I was thinking.
Go ahead, sorry.
I mean, I'm thinking this, but I don't think it is what it is. But this is cavity.
Cavity is a hole. Cavity is just a hole. Foramen is the right word, but what would be a big hole? It's in the picture, by the way. I'm not asking you questions that aren't right in front of you. But what's the word for big that we're kind of familiar with?
Magnus foramen, or the foramen magnum.
Foramen magnum. Yeah, big hole. That's literally all it means. By the way, I wasn't expecting you to know that. What I want to just show you guys is that, like, If I said that to you again, you'd know what I was talking about. Because you know enough Latin now, you'd be like, foramen magnum. That's the big hole. It's a big hole in the bottom of your skull that your spinal cord comes out. You'll never see this. If you do see a foramen magnum, scream. Something is terribly wrong in your world. But that's just making a little point there. Cute point. Okay. All right, we already talked about the temporal mandibular joint. Very simply in English, what is the temporal mandibular joint, Miss Felix Osuna? Just in simple English, what is the temporal mandibular joint? If I had to explain it to a 5-year-old, what is the temporal mandibular joint?
It's the joint in the middle.
The what?
It's the joint in the middle. And between the temporal bone.
I'm 5 years old. What's my temporal mandibular joint? You're right, by the way, but
Joint? Yeah.
it's your jaw joint. Right?
Yeah.
Cool. All right, moving right along. We will talk about sutures later, but you have them in your head. And we will talk about the hyoid bone later. But the hyoid bone, a lot of people think it's their Adam's apple. It is not. Your Adam's apple is some cartilage that's in your windpipe, right? But the hyoid bone is the only floating bone in the body, meaning it's not attached to any other bone. Now, it's got a whole bunch of muscles hooked to it, so it doesn't just float off into space. But it's a bone that's actually attached to your tongue and other things like that. It's one of the reasons you're able to swallow and talk and do all that stuff. We take it for granted, but it's unusual to use something to do so many different things. Like I chew with this thing, I breathe through this thing, and I articulate all sorts of really interesting words through this thing, which takes a lot of control with my tongue. And a lot of that has to do with the hyoid bone, helping to puppet all that and control it. Ms. Cooper, you have your hand raised.
By accident.
Okay, cool. All right. Let's review sternum bones, rib bones, things like that. This is just review, by the way, so far. We haven't really touched anything new. But you guys know this. What are the first 7 ribs called, Miss Hunter?
First 7 ribs.
Yes.
First 7 ribs are true ribs.
Yes! Okay, since you're on fire, Miss Hunter, what are the next 3 ribs called? 8, 9, and 10.
Floating? Those aren't floating.
That's false.
Oh, false ribs.
Yes, that's true. Wait, no, those are 1 through 7. Yeah, 1 through 7 is true. 8, 9, and 10 are false. And what's 11 and 12?
Those are floating ribs.
Yes. They're floating because they're not attached. They're attached in back, but they're not attached to anything in front, right?
Mm.
Yeah. Hey, what's this pointy little thing that I can actually feel at the bottom of my sternum?
Xiphoid process.
Oh, it hurts. Yeah, thank you. Okay, cool. Love that. Very helpful. Thank you. 24 ribs, 12 pairs. Yep. I'm not worried about any of that stuff yet. We already talked about the vertebra columns. Oh, hey. This is a really great picture of the ligamentum nuchae. They have it down here as the nuchae ligament, but it's ligamentum nuchae or nuchae ligament. This is the ligament that attaches to your external occipital protuberance and down to your vertebra prominens. Hey, which vertebra is my vertebra prominens? Where's that? Most prominent vertebra. What is it? Well, let's see. Somebody's got their hand raised. Miss Nguyen, you raised your hand, maybe by accident, but you raised it.
I think in the natural ligament.
Which vertebrae is my most prominent vertebrae? It's C what?
No, I stopped. So I don't know that. I think in the C. I don't know. I think in the nuchal ligament.
It is the nuchal ligament. You're right about that. Ligamentum nuchae.
Yeah, but in the C7.
C7, yeah. Attaches my external occipital protuberance to the spinous process C7, but people think of it as just a rope, but it actually runs into your spine. This is a very good picture of it to kind of give you guys an idea. It fills in the back of your neck and it helps support the weight of your head.
Yeah.
Cool. Thank you, everybody. We've already talked about vertebrae. Yeah, we're fine. Hey, by the way, really quickly, when we talk about somebody with a herniated disc or a blown vertebrae or any of that stuff, slip disc, herniated disc, blown vertebrae, your disc doesn't really come out from the side, but what happens is the disc center jellies out like that and pushes on a nerve. So in the picture, the nucleus pulposus comes out from the center. The jelly in the center that's supposed to give you kind of cushion squeezes out to the side stuff. That's the idea of a herniated disc. And it pushes on the nerves, and that's what hurts so much. Because it's supposed to just be cushion back there. Okay, so we've already talked about all this stuff. Oh, look at what's C1 called? Miss Bilotic, what's another word for C1?
Atlas.
Yes. Hey, Miss Bilotic, what's another word for C2?
Axis.
Yes. Miss Bilotic, what's another word for C7?
The vertebra prominence.
Bam! You knocked it out of the park. Thank you very much, ma'am. Okay. All right. Boom. Okay. So that gets us just through the bones that we wanted to talk about before we talk about all the muscles that move them around. That was just a very fast bone review, right? Right. Okay. I don't think we should get into muscles of movement yet for this second part. You guys can do matching tonight. I want to do a really quick review of general muscles before we get into muscles tomorrow that actually move stuff around. Okay? Are you going to say something, sir? Mr. Kandars? You popped in for a second. No, okay. Good times. All right. So really quickly, let's just kind of remember some muscles in our body. Yeah? Yep, let me stop presenting here. Hold on, stop sharing that. Boom. Give that. Okay. Are you feeling overwhelmed, by the way, or not? Feeling, yeah, overwhelmed, really? I don't want you to feel too overwhelmed. You guys did pretty good. It's just a lot of stuff, right? It's all coming together, and we're not done yet. We're not done yet. We covered a lot, huh? Like, we've come a long way. Yeah. Okay. I got you. Who raised their hand? Somebody? No? I thought they did. Okay, I heard that. Oh, Miss Petrie, you raised your hand. Sorry.
It's okay. I personally feel like there's a lot that I forgot maybe. So as we're saying them, I'm like, oh, okay. I mean, I remember the words, don't remember exactly where they fit. Yes?
So, let me explain something more about our teaching philosophy. So you understand what we're up to. Because it's not a secret. So for one thing, we circle back on stuff, right? You heard all this stuff before. This is us circling back to it. And we will circle back to it again because we believe that's how learning occurs. You have to hear stuff more than once. You also had a lot of stuff to learn about along the way that we couldn't teach you until you had all these moving parts and we're starting to put them together. But the other thing is we tend to kind of teach the course up, 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 and up, and then come back down here. And the reason we do that is most massage schools just kind of teach down here, and that does a disservice to you if you really want to learn some kinesiology and things like that. So we teach this course really hard, but it's a lot to cover, and it's not 700 hours. I only have you about 300 hours because you've got internships and all sorts of stuff. So we've got 300 hours to cover a ridiculous amount of information. College level kinesiology stuff. But we will tie it up at the end where we actually come back downhill a little bit, just make sure you can recognize muscles and things like that. And we find that works really well to overshoot a little bit, to like push yourself a little bit beyond where you're at. And so it's what we're up to. We want you to feel confused at times. We really do. And apparently that's working. Sorry. Okay. Anyway, so let's go back a step. Back a step. Miss Moore, can you tell me what 3 muscles make up the calves in what's called your sural region of your leg, which is the posterior region of your leg? Can you tell me the names of your 3 calf muscles?
One is the soleus.
Soleus is 100% correct. There's one on top of that
One is the plantar fasciitis.
How about plantaris?
Oh, plantaris.
Yep.
And the other one is the
Yeah, starts with a G.
googly. It's not googly.
Gastric?
Gastrocnemia.
Yeah, gastrocnemias. Good job. So what were those 3 again?
The gastrocnemius, the soleus, and the plantaris.
I know why you're getting confused in the plantar fascia, which is on the bottom of the foot,
Yeah.
so that's good. It's a lot. Okay, Ms. Torres. Ms. Torres, what
Yes.
are the 3 hamstrings that are found in the posterior compartment of the thigh?
Is the bicep femoris. Oh my God, why is it in my head and I can't say it?
It's hard.
Semimembranosus, semitendinosus, bicep femoris.
Thank you. Hey, Ms. Torres, since I have you here, what are the 3 calf muscles?
Gastrocnemius, soleus, and plantaris.
Great. Thank you so much, ma'am. Ms. Monreal, what are the 5 hip adductors found in the medial compartment of the thigh? Miss Monreal, please tell us.
Hey, sorry. My daughter
Yeah.
was distracting me. What is the question?
What are the 5 hip adductors found in the medial compartment of the thigh?
Okay. Gracilis, brevis, adductor brevis, adductor longus.
Yes? Keep going.
Hold on, I have to start over. Okay. Pectineus, gracilis, adductor longus, adductor magnus, adductor brevis.
Yes, very good. What are your 3 calf muscles?
Gastrocnemius, soleus, and plantaris.
And what are your 3 hamstrings?
Semitendinosus, semimembranosus, and biceps femoris.
Good job. Thank you, ma'am. Ms. Felix Osuna, what are the names of the 4 quadriceps femoris muscles, the 4 muscles on your anterior and lateral compartment of your thigh?
Is it quad?
Yeah, quads.
Quad. So it'd be the rectus femoris. Does it include the vastus too? Okay. Vastus medialis, vastus intermedius, and vastus lateralis.
Yeah, good. So that was the 4 quads. What are the 3 hamstrings?
They're the biceps femoris, tendinosus, and semimembranosus.
Good. What are the 5 hip adductors?
The pectineus, gracilis, adductor magnus, and adductor longus, and adductor medius.
Brevis.
Brevis.
Good. And what are the 3 calf muscles?
The plantaris, soleus, and gastrocnemius.
Beautiful. Thank you, ma'am. Thank you very much. Miss Hunter, are the 3 gluteal muscles?
Minimus, maximus, medius.
Yeah, gluteus minimus, maximus, and medius. What are the 4 quads?
Quads. I know she just said it too.
It's okay. It's
Quad. Is it vastus or no? Oh, okay. Because I always get this mixed up. Vastus intermedialis, medius, lateralis, and rectus femoris.
Okay, and what are the 3 hamstrings?
Semitendinosus, semimembranosus, bicep femoris.
Yeah.
Okay.
What are the 5 hip adductors?
I don't like those. Anyway,
They don't like you either.
adductor magnus, adductor brevis, pectineus gracilis.
Adductor.
Oh, longus.
Thank you.
Why do I always forget that one?
Because you don't say them in order. You always want to go big, little, long, or something like that. You know, get those out of the way first. Yeah.
I just try to remember the words. But yeah.
What are the 3 calf muscles?
Soleus, gastrocnemius, and plantaris.
Yes, thank you very much.
Yay.
Miss Nguyen,
Yeah.
you know I love you.
I love you too.
Well, you used to. What are the 5? What are the 6 deep 6 lateral hip rotators found underneath the gluteus maximus?
OB.
Obturator.
Obturator. Obturator. Internal.
Internus, yep, and obturator.
Obturator. External.
Externus, good. Then we got a
And quadratus
femoris, four-sided quadratus
Yeah.
on the femur, yep.
Piriformis.
Piriformis, the one that can pinch the sciatic nerve, piriformis pinch. Yep.
And then Gemellus superior and Gemellus inferior.
Yeah! Wow. Okay, let's leave it at that because that was really, really good. Yes, thank you.
Yeah.
Thank you, ma'am. Miss Bolotic. Miss Bolotic, what are the names of the 3 gluteal muscles?
The gluteus maximus, the gluteus minimus, and the gluteus medius.
Good. What's the name of the deep 6, the 6 lateral hip rotators found underneath the gluteus maximus?
Sorry, I'm blanking.
It's okay. You've got a gemellus up and down. So what's the word?
Can I look at my book? Or?
Yeah, but you could also use the clue. If you have a gemellus that's above, what do we call stuff that's above stuff?
Superior?
Yes, gemellus superior, which means we also have a gemellus
Inferior.
Yes. Then we have an obturator inside. Internus.
Internus.
And then we have an obturator outside.
Posterior.
Externus. Obturator externus.
Sorry.
No, don't be sorry. By the way, I'm not laughing at you but it's just cute. You're like, whatever. Anyway, it's fun. And then we have a 4-sided muscle found in the femur. What's the word for 4?
Quad.
Yes. So, and 4-sided is quadratus. And then it's on the femur.
Quadratus femoris.
Yes, excellent. And then we have one last one, which is the most important one because it can pinch the sciatic nerve. It starts with a P.
Piriformis.
Piriformis. Good job. Thank you, ma'am. Thank you. Okay, Miss Hanson. Hi. Miss Hanson, What are the 5 abdominal muscles?
You have your internal obliques, your external obliques, there's a long one. Rectus abdominal.
Good. So rectus abdominis or rectus abdominal, internal and external obliques, good. One that goes around you, pretty much. What's that called? Starts with a T.
Transverse abdominis.
Mm-hmm. And then the last one is the deepest abdominal muscle there is. It is a 4-sided muscle found in the lumbar region.
Quadratus lumbar.
Yeah, that was good. Good. Okay, let's give you a break there for a second. Miss Giannis. Hi, Miss Giannis.
Hi.
Hey, Miss Giannis, what are the 3 erector spinae muscles, the ones that run up and down my back? I call them spinal erectors, but erector spinae muscles.
Longissimus. The spinalis. The iliocostalis.
Yeah. Now say them with confidence because you got all 3 of those perfectly right.
Longissimus, spinalis, and iliocostalis.
Great job. Thank you very much, man. Hey, since I got you though, what are the 5 abdominal muscles?
Transverse abdominis, internal and external obliques, quadratus lumborum, and rectus abdominis.
Yeah. I mean, and since you're here, what are the 4 quads?
Rectus femoris, vastus medialis, vastus lateralis, and vastus intermedius.
Well, gosh, you said them so fast, we've got more time. What are the 5 hip adductors?
Adductor brevis, adductor longus, adductor magnus, pectineus, and gracilis.
What are the 3 hamstrings?
Semimembranosus, semitendinosus, and the biceps femoris.
What are the 3 calf muscles?
Gastrocnemius, soleus, and plantaris.
What are the 3 gluteal muscles?
Gluteus maximus, medius, and minimus.
What are the deep 6?
Piriformis, oh no.
Don't say, oh no, Miss Giannis, you just rattled off like 75 muscles really well. Do you want a hint?
The internus and externus.
Yeah, obturator, internus, and obturator externus. Then you got gemellus.
Gemellus inferior and superior.
Yes, and did you say quadratus femoris? And which is the one that pinches the sciatic nerve?
The piriformis.
Yeah, you're done. You did great. Sorry. We were on a run. I had to go for it. Yeah. Cool. Miss Harper. Miss Harper, I haven't asked you this question. We've been talking about all these muscle groups and all that kind of stuff. What is the muscle that runs diagonal over my quads in front of my body? In front of my thigh?
The sartorius.
Yes. What is the muscle that runs in front of my shin? In front of my
shin?
Yeah, in front of my shin, in front of my tibia.
In front of your tibia.
Yeah,
the
which is
rectus femoris.
not my femur, my tibia, way down in my shin bone. I pretty much gave you the name, in front of my tibia.
In front of your tibia. What is this?
I like to call it tibia infrontis.
Huh?
I mean, that's just what I like to call it. There's probably a better name.
Tibia infrontis?
Yeah, but what's another word for in front?
Lateral.
Lateral side, medial's towards the midline.
Oh, anterior.
Oh.
Front, right?
Yeah, maybe we should call it tibialis anterior.
Okay.
Yeah. Sorry, I'm throwing stuff way out of left field for you.
Do we learn that? I forgot.
We have not gotten to lower leg in class. It has been
Okay.
mentioned in passing a couple times. I've definitely mentioned it, but it's not something I would expect everybody to know. We have not studied below the knee yet, and that's where this muscle lives.
Okay.
We were talking about the calves so much, I wanted people to realize there's a very important muscle in front in your shin.
Okay.
And that's the anterior tibialis or tibialis anterior. I don't care which way you say it. Sorry.
No, you're good.
That was not nice at all. What are the four, one last question, Ms. Harper. What are the four rotator cuff muscles of your shoulder?
Oh, the rotator cuff muscle of your shoulder is that the supraspinatus, the infraspinatus, and teres minor, and the subscapularis.
Beautiful. Thank you, ma'am. Thank you. Mr. Kandaris, sir.
Yep.
What are the three calf muscles, sir?
Gastrocnemius, plantaris, soleus,
Bam! What are the three hamstrings?
semimembranosus, semitendinosus, and biceps femoris.
Bam! What are the three gluteals?
Gluteus, maximus, minimus, medius.
Bam! What are the three spinal erectors?
Iliocostalis, spinalis, and longissimus.
Bam! What are the four quads?
Vastus lateralis, intermedius, medialis, and erectus femoris.
Bam! What are the five hip adductors?
Cutineus, gracilis, and adductor magnus, brevis, and longus.
I love the way you said it. Thank you. What are the deep six lateral hip rotators?
We got the piriformis, the gemellus superior, the obturator internus, the gemellus inferior, obturator externus, and the quadratus femoris.
I think that was correct. You didn't say them in order. It threw me off, but that was great. You did fantastic. What are the five abdominals, sir?
Internal and external obliques. Rectus abdominis.
Yeah.
I'm forgetting the other two right now.
Transverse abdominis and quadratus lumborum. You did great, though, sir.
Okay.
Let it go. That was great.
Thank you.
Miss Monreal,
Yes.
what are the three muscles that insert into the medial side of the tibia that make up the pes anserinus? Sartorius.
Semitendinosus.
Semitendinosus.
And
It's an adductor.
hold on.
Adductor.
The gracilis.
Gracilis. Thank you.
Gracilis.
It's your name, so you got to know it, right? Yes. Miss Cooper. Hi, Miss Cooper. Miss Cooper.
I was waiting.
What are the four rotator cuff muscles in your shoulder? Four rotator cuff muscles in your shoulder.
Supraspinatus, infraspinatus,
Anytime you say infraspinatus, you also say,
teres minor,
yeah!
and subscapularis.
Bam! Thank you, Miss Cooper. I got to stop right there because we're running out of time. Miss Petrie. This is a tough one. It really is. We talked about it today, but it's tough. Can you tell me a couple of muscles that insert into the mastoid process of the temporal bone? One has the word mastoid in it.
Sternocleidomastoid.
Yes. Sternocleidomastoid.
There.
And then there's also one of your erector spinae muscles.
Longissimus.
Yes, those are the two I really want you to remember. Yeah.
Okay.
Yeah, very good. The last one's splenius capitis, but you nailed the big two that triangulate from front to back. You know what? There's a lot we don't know, but it sounds like there's a lot we do know. Would we all agree on that?
Yeah.
Yes. Okay. We will all get there. Thank you guys for a fantastically engaging day. I'm very excited.